So let's take the next question that has been associated with a urolithiasis. So a young patient that presented to the OPD with a recurrent colicky abdominal pain. Now the urine examination shows the presence of RBC. Okay, so in the urine examination you are able to find there is a RBC is there, and the following crystal shapes in the figure. So this is basically an hexagonal shape, right? Hexagonal shape. Okay, and there is a recurrent colicky abdominal pain. Okay, so let's try to understand what is the options we have. So as there is a presence of RBC, that will eventually suggestive of hematuria. So we have hematuria with colicky pain, and we have the hexagonal shaped crystals, okay, in the urine. Now let's try to understand. We have the option D, that is your polycystic kidney disease, right? So regarding the polycystic kidney disease, these are the disease typically present in such a manner. There is a cyst formation. It's a abdominal lump which is basically cystic in nature. The typical clinical features are there is a pain abdomen, sometimes it's a colic in nature, and the hematuria. Okay, but the big but is that it's a typical urine crystal shape that has been found in the urine examination, like the hexagonal, that has been not found in case of polycystic kidney disease, which is much more specific of cystine stone in that case. So it's a big no. Then we have the oxalate stone. Your oxalate stone typically seen if it is monohydrate, it's a dumbbell shaped, right? It's a dumbbell shaped. But if it's a dihydrate, it can be seen as a envelope shape, right? Envelope shape. So it is not even going to be your answer. Then you have the glomerulonephritis. So a patient with a glomerulonephritis can present with a RBC in the urine, and there is a some amount of the urinary recurrent abdominal pain also can be seen depending upon the cause. But same thing, this hexagonal shaped crystal, that is basically going to be absent in such cases. So this hexagonal shaped stone crystal that has been found typically in case of cystine stone only. So this is going to be your answer. This is going to be answer. Look, students, you have to understand these are the such kind of questions, like simply just looking into the crystal shape you must answer this question. Okay, so this has been asked multiple times in the NEET PG, INI set, every examination. So you have to learn it properly. Okay, so let's have the image as well. So this is your cystine stone, as I have already mentioned. So this is the calcium oxalate stone. So it's a typically looked like a envelope shape, right? Envelope shape. So it's a basically calcium phosphate stone that you can able to see that. Okay, it's a rosette kind of manner, rosette kind of shape, and this is a struvite, which is your coffin lid shaped, right? So regarding the cystine stone, these are the pretty much rare, right? And there is a inherited disorder that is basically known as the cystinuria, where there is a defect in the tubular reabsorption of the amino acid, that is cystine, where it can eventually form this kind of crystal as well. Okay, so as I have already mentioned, what are the reasons to rule out? Obviously not linked to hexagonal crystal, not linked to hexagonal crystal. It's a dumbbell or envelope shaped, and the polycystic kidney disease, same thing. Okay, so this was our discussion regarding this MCQ.